Today we're diving into an exciting topic at the forefront of health and wellness, the regenerative benefits of biostimulators for improving skin appearance. Now, these innovative treatments are transforming the way we approach skin rejuvenation by stimulating the body's natural processes to restore youthful and radiant skin. So joining me today to explain how these biostimulators work and the science behind their benefits is Dr. Mark Opperman. So Mark, we have touched on biostimulators in the past, but let's just give a brief recap of exactly what a biostimulator is and what the function of it is.
So Michael, a biostimulator is a product that when you inject it or use it in the skin, it stimulates a biological process. And for most biostimulators, this would be producing more collagen. Now we have different types of collagen, etc., etc. But I think the important fact that we need to remember is that although all biostimulators will stimulate collagen, not all biostimulators are regenerative.
Okay.
And in today's medical field, we are so excited about regenerative therapies. And when it comes to regenerative therapies for the skin specifically, there is a compound called PLLA, polyl-lactic acid, SCA, which is a brand name.
Okay.
And it's a specific one, and it's the only one with a lot of scientific data. And when I'm saying a lot, over 400 studies,
Sure.
that proves not only does it stimulate collagen, but it stimulates elastin. It improves the extracellular matrix.
Okay.
And what is so important and what is new in our research around this product is that it changes gene expression.
Okay.
So it upregulates the genes that are responsible for elastin in the skin, which is on par with the importance of collagen. And then it downregulates genes that is associated with the formation of pigmentation.
Okay.
So not only are we treating scarring and pigmentation and luminosity, but through its action on elastin and collagen, you're also creating lifting, you're creating tightening of the skin, addressing sagging, laxity, volume loss in the skin. And it sets it apart from other biostimulators, which are often pro-inflammatory and will express genes or activate genes that code for chronic inflammation. So when you talk about biostimulators, be very sure which one you are using. And in my professional opinion, PLLA-SCA, because of its scientific body of evidence, is by far the most appropriate and most effective one to use.
Okay. It's so interesting, Mark, because from what I'm understanding here is that you're actually sort of rebuilding the structures within the skin, so that it's not a fix for a while. You're giving it a chance to almost go back a few years. So it's anti-aging in a practical way.
Michael, the wonderful thing about PLLA is, number one, that it's a natural process. We actually ferment carbohydrates, and specifically beets and cornstarches.
Okay.
So it's a fermentation process that then gives you lactic acid. Now, we're all familiar with lactic acid. We build it up in our body.
Yes.
So it's biocompatible.
Okay.
And it integrates with the tissue. So when you take these lactic acids and you build a strand from it, so you form polyl-lactic acid. Now it stimulates cellular processes to activate fibroblast activity, and fibroblasts are responsible for collagen formation, and collagen gives structure and strength. And then it also activates gene expression for elastin. So now the skin becomes firmer and more elastic. And it addresses sagging and laxity when you start pulling the skin away.
Yes, yes.
And then on the luminosity and volume side, it's brilliant because it stimulates the extracellular matrix, it downregulates pigmentation formation, treats scarring, And unfortunately, we can't say the same for other PLLA molecules or for other biostimulators. And hence, we can say all biostimulators are collagen producers, but not all biostimulators are regenerative.
Okay, right. So Mark, let's take a look. You've got an image here of somebody that you've worked with.
Yes.
So tell us where the action has happened here. I mean, you can see there's a much brighter looking face on the right-hand side here.
I think it's not only a brighter looking face. If you take a look, the patient looks more rested, but there's volume loss that has been addressed. Specifically in the temple area, if you take a look at the temple area.
So you don't have that sort of sunken look as you see on the right.
So natural volumization through a stimulatory process. You can see that there is lifting of the skin. Just take a look at the jowliness and the fine lines. The wonderful thing about using something like PLLA-SCA, and in our terms it's called Sculptra, is that it gives you a panfacial rejuvenation on volume loss, on sagging, on laxity, on luminosity. And as we can clearly see, this patient is 59 years old. She wasn't bad looking to start with. And by using this treatment over three sessions, you know what, it's given her a far more approachable, refreshed, natural look, and that's what our patients want today.
And I think that's so important because here again, you've not taken somebody who's of an age and turned them into somebody who looks a little bit unnatural because you've done too much with it. And Mark, you also mentioned that this was taken not long after the procedures, but now there's been some time that's passed, and there's further rejuvenation that's happening. So it's sort of an ongoing process for a period. It's not a sudden thing that changes, so it's gentle in a way.
So Michael, the wonderful thing about a biostimulator is that the process is ongoing. When we look at PLLA, polylactic acid, number one, it's biocompatible and it's biodegradable. So it integrates with the tissue and it breaks down naturally into water and carbon dioxide. So it's not something foreign. It's sustainably produced from plants, like, as I said, beets. And the action starts within 14 days and lasts for longer than 2 years. So it's a progressive treatment that keeps on getting better and better and better. It's wonderful. There's no downtime after a procedure like this. You can do it today, and this evening you can go to a function. You can't see anything on the skin. It's safe to use. It's a fairly easy procedure in the hands of an expert. And it can give phenomenal results. And the wonderful thing is it's suitable for all ages. You can do this in your 20s as a preventative treatment, and you can do it in your 70s as a regenerative treatment. So it's phenomenal.
Mark, if somebody wanted to find out more about this procedure, where can they get hold of you?
You know what, Michael, the easiest to call us at our number in Johannesburg. The number is 010-824-1393. Otherwise, go and take a look at our website, Dr. Mark Aesthetics, or you can just click on the T-Clinic page as well.
Great stuff. Mark, thank you so much. We will be exploring a bit more about this, especially when it comes to men next week, so I look forward to that conversation.
Thank you.